It is Friday, November 20th. We want to welcome you all into Coronavirus Inside the Arizona Numbers, where we take a closer look, as we always do, at the data that comes out of Arizona as it pertains to the coronavirus. Let us know where you're watching from. This is hopefully it's information that you can use even if you're not in Arizona. Apply it to your local municipalities to get the data you need to make the best decisions for your family. You know their health and lifestyle best, and we're just here to help you be guided through the data that's coming out. It can be a lot to look at, and it's been 10 months now, Garrett. This week is we're 10 months into reporting on this, 10 months into keeping everybody updated, and a lot to talk about today. It's kind of a mixed day. I was telling you this off camera before we started. Kind of a mixed day because here we have, Pfizer applying for FDA approval and saying that they're 95% effective and really wanting to get this out in about 2 to 4 weeks once the approval comes out. And then how do we get it out to everybody? So this part is hopeful. And then we have these numbers coming out of Arizona that are really, really concerning. We had 4,000 cases that we told everybody about yesterday. We have 4,000 plus cases today. You put that all together, and ultimately a chunk of those people end up in our hospitals. So we have all that to talk about today. And we're seeing all the cities you're saying you're watching from. Thanks so much for joining us. We'll get to questions and hopefully try to help you find this information. We know Thanksgiving's coming up, and a lot of people are making some really tough and difficult decisions right now. So, all right, Garrett, let's start where we always do. On the data page from AZDHS, this is the second highest day of reporting in the whole pandemic for cases.
Correct. For cases, this is the second highest. 4,471 cases reported today by AZDHS, and that is the second highest. Only July 2nd is higher than that, and I'm trying to go to that and see what it was. July 2nd was 4,433. So just off, really, what is the high in the pandemic at this point for reported numbers. That puts us at a 7-day average of about 3,200 cases a day being added to the system. That's growing by about 200 cases a day right now. Yesterday it was 2,950. The day before it was 2,562. So our 7-day average is shooting up right now in sort of an exponential fashion. And then the death report of 43, that's causing the average death report to increase as well to about 24. That one is not moving as fast as the cases, but it's still moving up at this point.
So now pretty much everybody knows somebody who either has coronavirus or has had it in the past and battled through this, hopefully with a better outcome. But our death numbers are high as well. And we think of every single family across the country. 253,000 families have lost someone. And our number here in Arizona is now at 6,427, a substantial number added today to that.
Yes, absolutely. Sorry.
It's overwhelming because the number of cases that we see when we see these cases come in, and some people dismiss it saying, oh, it's just cases. But if you take 4,000 cases or 8,000 cases in the last couple of days, 8,000 plus, closer to 9 if you total it all up, and you say about 10% of those end up in Arizona hospitals, that's an influx of 900 patients coming up. And you can see why our hospitals are so worried about all of this. We didn't have time to update everybody on our hospitalizations yesterday. How do things look right now as we're starting this?
So this is where we are. It's a little hard to, it's quite simple to see. The red line is the COVID-19. The gray lines are the non-COVID-19 patients that are in the hospitals, and the light gray is basically the headroom of what we have. This is the ICU intensive care unit. We can see that we have about 12% headroom at this point, and that is up from sort of our low right here of 26% headroom. So we are increasing in the amount of people in ICU. They do like the hospitals, just based on conversations I've had, they do like to keep it from that 80 to 90% ratio. So they're getting to the point where they're having to move people off of, we saw something from, I believe, Mayo said something today that they're now, any surgeries that haven't been scheduled are being, any new surgeries, I guess, are being pushed off right now. So they're getting heavy. I mean, I think the biggest concern right now is that our hospitalizations right now are starting to they are increasing. What we are talking about is that every time these inpatient numbers, we just looked at the ICU, the inpatient numbers, as they continue to go up as well. What the conversations I've had with people is that the numbers, the COVID-19 cases, they require much more staff. So while we see this headroom is not changing too much, and they try to keep it within that 80-90 percentile range, but because this requires more hospital staff, the concern is as this rises to where it was in concerning levels back in July, where it was 43% of the population of hospital patients were COVID-19, it becomes very staff intensive, and it becomes a problem for them. So more so than it is now.
One of the things that we saw in July is we were able to call on other states, places that did not have high numbers of coronavirus right at that point. So everybody was obviously still experiencing the pandemic, but at different waves, if you will, in different parts of the country. We see our high part in July there, heading into something, again, that seems to be quite dramatic. And the big question is, do we have enough healthcare workers when we can't call on other states to bring people in? So we see these charts and they register beds, but do we have enough people to staff all that? That then becomes the big question. So as you mentioned, some of these numbers changing fast.
Yes.
The hospitals are making some decisions here, and most of them are happening this weekend. So it's worth noting. Banner Health moving into red status. So that's no visitors with very few exceptions. That's going to happen by Sunday. The VA hospital, they're shutting down their visitors by Saturday, so tomorrow, except any of those end-of-life cases, and they're going to look at those on a case-by-case basis. Mayo Clinic has closed to visitors. Valley-Wise is saying you're going to be allowed to have one healthy parent in there if you have a child in the hospital, and one healthy adult if you're giving birth. So you have somebody to be there with you if you're giving birth. But that's it. And Dignity Health is saying they're only going to let a visitor of one adult in from 4 to 8 p.m. at night. So the hospitals are taking this very seriously as they're seeing these numbers increase. What other metrics are coming out of the hospitals? And then I see a few questions we can get to after this.
So just going through another one of these. Now, this is an interesting metric. It is not beds occupied. This is the emergency room numbers. And this is, again, not beds occupied. Excuse me. Let me back this up a second. This one is actually beds occupied. It's the way that they put this. I'll show you the one that is not beds occupied. But this is basically emergency beds that we're seeing in use. And as you can imagine, as most people we know have at least been to the emergency room once, you know that oftentimes people who go to the emergency room don't stay in beds. So this just basically is an indication of what the head count is on one given moment in the emergency rooms. And you can see even though we're taking just a snapshot every single day of the beds, it is increasing. We're now up to about 53% of the emergency rooms being COVID utilized.
Yeah.
No, that's not COVID quite yet. This isn't a COVID number. This is 1,275 of
just
the
visits.
hospital beds, and that could be anything. That could be, but COVID is part of that. I will go really quick to show you what those COVID-19 specific metrics are. And this is right here. We can see the COVID-19 emergency room visits. So even though this is something that whenever you look at these two graphs, they are slightly mutually exclusive, because the emergency room visits for COVID-19 does not necessarily mean that these people have stayed and are occupying a bed at the emergency room when the bed count is being done. So, but you can see, no matter what, you look at this, we already talked about how this was an error. That's why there's this large drop right here. But even when you discount that error, we started from a low in September 23rd of about 700 patients, and now we're double that in 2 months of emergency room visits for COVID-19. And this is one thing that impacts the CLI. So we talk about that data metric that will tell us if the schools and the counties are going to start shutting down, and the CLI is a very important part of that metric. And this is something to watch going forward, because this is going to impact the CLI number.
So you're talking about closures, and that brings up a real hot topic right now that we're seeing really between parents and business owners, and some of those categories overlap. There's a lot of parents who have kids in school who are also business owners, and this conversation that's starting really everywhere right now is, what closes first. So in our state, we're seeing a lot of closures of schools. And by the way, if you're interested in that list, you can find it on abc15.com/schools. We've got a whole list of schools that have shut down as these new numbers have come out. But the conversation that's starting around the country is, which should close first? Do you close down your businesses and keep schools open as long as you possibly can? Or do you close down the schools first? And it's two different camps here, and it's got a lot of conversation. So I'm wondering in the comments what you all think about that. But we're really seeing it in New York, especially. People are saying, why can my child go to a restaurant and they can't go to school? So the conversation and the discussion about how you handle this is on, and different states are taking different measures at this point. But really, that's I'm seeing some of the comments here. I'm gonna horribly mispronounce your name, so I'm gonna say Asraf, I think is his name. He's writing, schools should close first. Schools should close down first. Lorna writes bars. She thinks the bars should close down first. So it's getting a lot of people talking. Just curious what you all think about all of this, and how we protect our most vulnerable, and then how we also sort of protect the economy, and in what order. Kelly's writing, children need their educators. One of the other things we didn't talk about yesterday, Garrett, too, is that how this vaccine is going to roll out in here in Arizona specifically. And we heard from Will Humboldt yesterday about this. And he's saying that when they roll out these vaccinations, it's obviously going to go to frontline workers next. But number two in that category is going to be teachers. So it shows how we want these kids back in school, and we want them there safely. All right. Okay. So let's get to some of the other numbers that you're seeing. I think people are starting to get the message that we are in this next wave, and as Dr. Birx called it, the fall wave, instead of labeling it the first or second wave or third wave, and that's reflected in the mobility. And we can actually see that now. There's so many interesting data sets out there that help us better understand this. Show everybody what you're seeing in the mobility numbers.
I'm going to show you the mobility chart that I use. There are places, if anyone's interested in seeing what the mobility is anywhere at any given time, you can find these. Google has a mobility chart, as well as Apple. And what they do is they take indexed. They basically take a bunch of anonymized, because obviously these two companies have a lot of cell phone data. So they take these anonymized cell phone data, and they basically, they do an index on how far people have traveled from home over a given time period. Now, I'm not going to use those today, because those particular reports that you can look at, you can download them and get them from the very beginning, but really the reports you can look at are only from the last couple months. And I want to look at something that shows basically the entire pandemic. So I have one that's from a place called Descartes Labs that also does the same thing. It does use the Google and Apple mobility data, but they're just easier to pull it out for someone like me who does this. And so I've got this. Let me just pop it in right now. So this is what we're looking at here. So starting from this is basically before the shutdown, and this is an index. Okay, what that means is the day before the shutdown, everyone was going about their lives at the typical normal trajectory, and then we shut down. And it went down to about 10%. People in April were only moving about 10% as much as they did in April than they did before the lockdowns. And then here we can see that's when the lockdown lifted, and we got to about 50% mobility. And then this is basically close to when we were starting to increase our cases were increasing at this time. And you can see this is when the mask ordinance came out. And so we started to see people just organically stop moving around and going back to about 30 to 40% mobility. And then as the pandemic sort of petered out from the summertime, and we went down to our sort of the lows that we've had since then, we started to see just an organic creep up of the mobility data that sort of, as you can see, culminated in about Halloween or so, where it reached its peak. And then now we're seeing sort of another downturn of that, and obviously with Thanksgiving coming up, we don't know what this is going to look like after Thanksgiving is ingested in. We'll find that out next week to see how much Thanksgiving does impact this graph, and then it'll be interesting, because as you can see, if you look at sort of the line, I know it's you just sort of have to imagine this line. You can definitely see that there's this slight bending even though there's, going up, if you look at from here to here, it's not going up in a full diagonal. It's starting to bend down again slightly. And but it's no idea what Thanksgiving's going to do to this yet.
Yeah, Garrett, how does that register? Is it distance from home? Is it amount of time away from home? I mean, what if somebody's traveling for a week?
Distance from home. So
Okay.
obviously you're anonymized. This is, again, all completely anonymized cell phone data. But having this data, if you're pinging it constantly, you can obviously find out where someone's sort of ground zero is, where their cell phone spends the most time. And then they have a base for everybody, and then they can basically use that as an index, and how often you travel outside of a 10-mile or whatever period they use. That's how they decide if you are mobile or not, if you're moving outside of your sort of immediate neighborhood. So this wouldn't pick up a trip to the grocery store. This would pick up like a trip if like someone in the East Valley were to go to Phoenix, downtown Phoenix, it would pick that up and register that as a mobility. But it wouldn't pick up, like I said, just going to the grocery store just down a couple blocks.
Super interesting. Okay, one other thing I'm seeing, and I'll get to some of the questions really quick. Phoenix Dooley is asking about the flu. How come nobody ever hears about the flu anymore? We can update you on that. The flu currently, Phoenix, is at sporadic. So there's 5 different categories of this: widespread, regional, local, sporadic, and no activity. So it's really low at this time. There's 32 cases reported in, and our normal range at this date in that same measured area is between 150 cases on a low year to 300 cases in a high year. So we're seeing 32 cases versus 150 to 300. So I wanted to update that. Pamela is also asking about where she can go to get tested in the East Valley. So many people are asking me about testing, Garrett, and I felt like I was repeating myself, but I'm realizing a lot of people are just getting a test for the first time. So I want to make sure everybody knows how to find that. On the AZDHS site, go to that site, scroll about halfway down. You're going to see the information on the testing. You'll be able to find the regular nasal test and also the saliva test on there. And Pamela is asking, where's the best place to get 15 people tested rapid? Pamela, I would have given you a different answer a couple days ago. Today's answer is anywhere you can get in, because we're seeing so many people starting to test right before the holiday that normal places were taking 24 hours. And now it seems like I have friends waiting about 36 to 48 hours to get their answer. So just get in wherever you can at this point.
Yeah, I would speculate that, well, we do have people increasing. Obviously, our numbers are increasing and testing is increasing. Today's testing number, by the way, was a record by far.
Huge.
Huge.
What was it? 27,000 people?
27,000 tests were processed. That is massive. And really, this was 27,000 tests that were processed in the last couple of days. So, while people will say, oh, well, the governor promised 60,000 tests. Well, I'm not here to defend the governor, but what this tells me is that the labs do have the ability to process 60,000 tests, and we might be in a situation where they're going to be doing that.
Wow.
So they processed these 27,000 tests in the last 3 or 4 days. So it wasn't like there was this massive 12-day lag and they were backfilling all over the place. These were popped in immediately. So
Yeah.
the testing is so far handling the capacity. So the demand, or the supply is meeting the demand, I guess is the way to put it at this point.
Yeah.
Now obviously, getting a test is getting harder to find just because all the appointments are booked up, all that other stuff that is causing sort of a backlog in people needing tests. But at least what we're seeing is, as long as they can figure out ways to get people tested, they're going to be able to process them.
Yeah, I see so many questions coming in. We'll try to get to a bunch of them right now. The test should be free. Wherever you go, the test should be free to get that test done. So I'm seeing some prices in there, but you should be able to get that for free. Kelly just asked a question a second ago. Let me see if I can scroll back. You guys are asking so many so quick. I'm going to have to look for her question. Oh, here it is. Kelly K is asking, do you think that more people are testing, so it's showing more positive results? So there's a way to find that exact thing. You want to look at the percentage of positive tests instead, right, Garrett? So that would help show if there's just more tests, more people, or the percent positive, if that's changing. Is our percent positive increasing?
Yes.
And how fast?
Pretty fast.
Yeah.
I'll pull it up right now. And that's sort of that's been sort of one of the things I've been watching pretty intently is that,
Mhm.
you'd think, a lot of people are saying, well, you're testing more so that you're going to get more cases. And while that could be the case, especially since we put out 26,000 tests today, the way that would work as far as saying, well, this means that COVID is not a big deal, you would see a lower percent positivity with 26,000 tests. The
Right.
number of cases that come in may actually increase, but because the volume of testing is larger, but the rate would drop. And we're not seeing that. We're seeing a higher rate. So I'm going to
So,
pull this
and
up
and
right now.
and Garrett, that's one of the things we can alert people to in when we look at our zip code map and our school district map as well. So you want to look at both numbers. That's why you see both of them on there. So anytime you see these, that's the way to double check that, because we heard that argument a lot when testing started to ramp up, and there were some political figures saying things about that: more tests, more positive cases. So percent positive is where you want to look to see that change.
Yes, so I've got the percent positivity rate pulled up, and there's two of them here. And let me just explain this, because I don't talk about this very much. So I just want to make sure when they're looking at this, the dotted line is the percent positivity rate of the reported cases versus the tests. So this is that number that we talk about every single day. When we start this, we say how many cases and how many tests for that day, and that is the line for that number. But you can see there's a different number here. This green line here is basically the positivity rate of actual date of collection. So this one is way more accurate as far as what's actually going on out there. And this one, as you can see, constantly has always, with the exception of right here, has been below the reported positivity rate, and that's because of a lot of backfilling that happens. And even in this this is accounting, in this sort of situation, any sort of backfill causes this to jump up, and that's why you can see the difference here. But you can see our positivity rate is at about 11% right now and rising. So today, for example, we've had 2 days so far. Well, the positivity rate is 12%, and this is an average. So of course, it's going to move a little slower, but it continues to go up.
Some people in the comments are asking about how many people end up hospitalized. So right now for Maricopa County, when you're looking at these numbers, it's at 8%. So it's been really between 11 to 8%. I always just do 10% for quick math. If you have 8,000 cases, you're going to see 800 people show up in our hospitals if this sort of follows the trend that it's been that it's had for the past few weeks. All right.
And just to remind people that while 8% is the raw number of hospitalizations, there is, when you look at the age groups, that number changes pretty dramatically. 30% of the hospitalizations are coming from the age 65 plus. So what that means is, obviously, if you're 0 to 19 or 20 to 44, you have a very low probability of being hospitalized from this. But if you're of a certain age group above that, your chances start to go up pretty dramatically. So, yes, 8%. But also remember that it's the older demographics that are impacted by the hospitalizations, and there are more of them in hospitalizations than there are those younger demographics.
Yeah, and anybody that's already fighting something in their system as well, long term. Okay, so
sorry, that sneeze. My apologies.
What was that? You have a sneeze?
I was about to sneeze. Sorry.
You know what? Hey, you know what? We've all been there, and it's actually more comfortable. You're at home here in the newsroom. There's not many people around here these days. There hasn't been the whole pandemic. You can see behind me. It's just there's where all the people usually are. But you sneeze somewhere in public, and you're just like, I don't have it. Everybody's been there. I know it. You're just like, I'm gonna hold my sneeze. I'm gonna hold it. I'm not gonna cough. I'm not gonna sneeze, even if I feel it coming on. I don't want to scare anybody. All right. Okay. So let's look at our RT number. That's something that we have tracked for everybody. Margaret writes, I'm sorry, Katie and Garrett, for the comments happening. Don't worry. We're used to all the comments on here. We're here to help people who want and have to make decisions for their lives, have the data to do so and have the best information to do so. And a lot of times this can be misread, and that's why we're so lucky to have a data expert here on staff, as we do with Garrett, to help us understand all of this. And our commitment to telling you about this began early in the summer, when we just there was so much information out there, and it was hard for people to decipher. So that's why we're here each day to try to help you. Sarah writes, I always feel a tickle or a cough as soon as I walk into a business or office. Isn't that the truth? It's like, oh my gosh. Yeah, you got to run back out, at least now. Okay, where are we on this chart? We're kind of high, it looks like.
Yeah, we're in the sort of the middle high tier here. Our rate of transmission right now is at 1.16. The thing to note about this, of course, is that our rate of transmission has remained above 1.1 or so, at least the reported one, pretty much for the past 2 weeks. And so one of the things about this is that it's very consistent right now. And I guess that's the biggest concern, is this number is quite consistent. When we go here, we can sort of see, and as I talk about this number all the time, I remind you that this is recalculated every single day that a new report comes out. So what yesterday's number is no longer relevant to this curve. So what this says is that we have been at above 1 since September 9th. So that is the time when Arizona's infectious rate went from shrinking to growing. And they're saying that, and then we start, because we were at quite a low on September 9th, but really that's when it started to, make its way into the community and start to increase these numbers. And you can see we've been at about 1.1 since late September. And the numbers do bear this out quite well, as we've seen with the increases that we're having. While we're not fully at exponential at at 2, that would be incredible if we were at a 2. We would be, everybody in Arizona would be infected with this thing in a matter of days if we were at 2. So 1.16 does indicate some measure of exponential growth at about every 2 or 3 weeks is what we're seeing. Is we're getting about double the number of cases every 2 to 3 weeks if we start from our low down here.
So when we look at this number, Deborah was just asking about Mississippi, and it seems that Mississippi is not doing anything different, that it might just be an anomaly in the reporting. So Mississippi's been in the green for a couple days, and Garrett, it's hard to tell. Are they doing something right? Is there some anomaly in their reporting? Is something happening there?
No, I really have to look at Mississippi, because it's been at this. That's been reported at this number for quite some time now, and you can see, as I clicked on it, but then I clicked off. What this is saying is that they've been under 1 since July 14th, and while it's very impressive, there's got to be some sort of reason as to why this is. Simply because they're the only state to be under 1 right now, and it doesn't really make sense at this point what's going on with that number. But again, I don't study Mississippi, so it's very difficult for me to look at that and tell you as to why it could be.
Why it stayed down there that whole time.
Yeah.
Okay, there's another question that we had to answer a lot early in the summer, and worth repeating. Hi, Denise. Denise writes, if a person tests positive 5 times, is that 1 or is that 5? She's just using that as an example number. She writes, and it is deduplicated, Denise, by your name, your last name, and your phone number. So you could go test every darn day, and you only show up as 1 case once you actually have a positive in there. So that is a really good question that we wanted to make sure. I see other people saying, please answer that one. That's the answer to that. So awesome question there. A couple of people have also asked about the modeling. So let's look at some of these projections. I'm not sure that they've updated since we looked at it yesterday. So if it has updated, we can spend a little more time on it. If not, we'll just quickly gloss over it, because we do have so many questions to get to, and I know you guys want answers before the weekend, since we're not here with you on the weekend. So
I can I think we can. We do have some projections from Arizona. Was that put into a story? Something from the ASU group, right?
You know what? Yes, and so from the ASU modeling, one of the big key takeaways in that is that here in Arizona, that they're projecting that our ICUs will indeed be full, and they're giving us a target date for that happening of December 18th, unfortunately. So that's why the rush is so on, because what are we at? My watch is not working. I need to charge it. November 20th. Okay, so we're less than a month away from that date, which is why these hospitals are taking these extreme measures, going into red status and shutting down to any visitors starting this weekend. And we went over that a little bit earlier in this video if anybody missed it, but the plans for Banner, for the VA hospital, for Mayo, for Valleywise, for Dignity, all making some changes into how they're going to let people in, and that's because of that and these numbers going so high. But their prediction from that ASU model is that the ICU will be full on December 18th here in Arizona. What a sad time too to be full the week of Christmas and not being able to get the care that you need.
So yes, I do have the ASU model up, so I'll just go through this really quick.
Okay.
This is very much presented for the AZDHS. It's really it's in one of those formats that are a little hard to digest. So I'm just going to go over it very quickly. This is their fit for total infections in Arizona, and this is believing that let's say around Christmas we'd be at about 30,000 or so infections, new infections on any given day. They do have a low and a high estimate here. So this is, as you can see, there's a lot of uncertainty as to our infections going from the farther you go. Obviously, this going all the way up to 80,000 for the high fit, and then for the low, it goes it basically stays flat from where we are right now. So this is hospitalization projections, and very much you can see this is the line that they're fitting. These are all the hospitalizations. This is where they believe it's going to continue. So right now we're at about 1,000, little over 1,000 hospitalizations, and they believe we're going to be at 3,000 by the end of January. And then ICU usage, same thing. They believe we'll be at about 600 ICU by the end of January is their median fit. Cumulative deaths, you can see this. They actually have a lot more certainty surrounding this number. They believe right now that our cumulative deaths are going to be anywhere from just over 5,000 to 7,000 by January. And then total recovered.
And Garrett, we should mention that's just for Maricopa County. So for perspective, we're at
Maricopa County. Yes.
We've lost 3,878 here in Maricopa County. So when they say 5,000 to 7,000, is that what they said on the high end?
Yeah.
That's just Maricopa County.
Yeah. Thank you for reminding. In fact, as soon as I said that, I realized it's like, wait, this.
Yeah. No worries. No worries.
This is for Maricopa County only. And you can see total recovered for Maricopa County. They believe anywhere from 20% of the infections to 15% will be recovered. So I'll just go through that right now. I'm going to leave the holiday travel assumptions right now until I get a little more time to study them, and maybe we can go over them on Monday. And go over what the ASU models think what's going to happen over the holiday weekend. So
for sure. I'm gonna open it up to a few more questions. So now would be a really good time if you have questions on where to find specific data for Arizona, so you can make the best decision for yourself and your family. Post that in the comments, and we'll get to those. I do want to highlight the situation across the United States right now. The numbers that have just come in, we just logged 188,000 cases in one day, 188,000 cases in one day, 2,000 American lives lost in one day. So we are in the height of this all across the country. The rise is not just in our state, but it's in more than half the country. And the rate of rise is the thing that's so concerning. So we talked about this a bit yesterday when we heard from Dr. Birx that she has seen a spring rise, a summer rise, and a fall rise. And it's the trajectory of this fall rise that has her most concerned about this right now, that this situation is going to happen faster across the United States, that it's going to be broader, more widespread. We talked about our healthcare workers needing to be pulled in, but from where? We're not in a situation like we were in July, and that this could be longer. And longer is the key thing here. Longer is where we can all do our part to sort of turn this around. It's about wearing masks, washing hands, social distancing, all the things that we have heard this whole pandemic. But this is the point that they're asking you to redouble your efforts, because faster, broader, and longer is the one that you can affect by making different choices for yourself and your family. Are there travel restrictions for Thanksgiving week? So we talked about some of the situations yesterday. You're going to want to look at your particular area where you're traveling to, because a lot of places have set up curfews. So in California, for instance, we learned yesterday, it was breaking while we were updating everybody here, that California's curfew is going from 10 p.m. starting tomorrow night until 5 in the morning. That's for everybody, unless you have some sort of medical issue going on that you're going there for healthcare. We also had 16 games called off, so it's affecting sports as well. And we talked about the AIA here in Arizona and those changes. Garrett, you are watching some of these questions come in. Did you see any of them that you want to quickly answer? Where can we find Prescott Valley numbers? Let's direct Brant to that for the weekend.
Sure. So Yavapai, so you'd have to go to Yavapai County's health department page to get that. That's yavapai.us/CHS. I'll share it very briefly. And that is right here. You can see Prescott Valley, 919 cases. That's an addition of 40 cases from yesterday. Now, that doesn't surprise me. Prescott Valley is probably the most populous area of Yavapai County. So having the highest number of cases, that sort of makes sense. And you can see Prescott is right there up there at 38, and then Cottonwood at 24. So now, if you're in Yavapai County, the one thing you also want to make sure you look at two separate things. First, Yavapai County is the only county to give us data on children. And we can see that right here. They can see that of all of the cases they've had, only 51 cases are from 0 to 5. And only 128 cases are from 6 to 12. And then you start getting a little bit closer to the case numbers of the adults when you get into the 13 to 17. Now you're at 291. And then you get into the other case numbers, which are, pretty much what we've been watching.
In line, right? Across the state?
Yeah, in line across the state. So you can see definitely, while, you get these others, 25 to 34, 14% of the case numbers, you can see what they do in Yavapai is they break out the kids. So you can see that really, the older you get until you get to about 65, the more likely you are to be impacted by COVID-19. Kids are just, they're not mobile on their own, obviously. If you're 0 to 5, you are absolutely going where your parents are taking you. So, and you can see that there's very low cases there.
Did I hear your daughter in the background there, Garrett?
Yeah, my daughter in the background. And, oh, you know what? My dogs just came home from the grooming.
Okay. So it's exciting at your house right now.
Yeah. So,
I smile. I know that situation well. I'm in the station right now, but juggling it all. We're all in this. We all get it.
And then the Yavapai hospitalizations. This is also a number to keep track of. This has gone up. In fact, it's gone up a lot since I checked it this morning. So yeah. I have it this morning at, let's see, really quick, because now I'm looking at it and I didn't have that this morning. I had hospitalizations this morning in Yavapai at 38. And that is that, I can't, I wish I could do that many numbers math.
It's okay.
A little amount of time.
I'm going to answer some of the other questions while you're doing that. Catherine's asking, and first of all, Brant, I hope Brant's writing that. Thank you very much that helped. And Brant, I hope you're able to at least Zoom with your kids over the holiday. I know that's the reason why you're asking about that area. Brant joins us on here a lot, so thank you. Catherine's asking, what's the website to check a particular zip code? Good question, Catherine. So this is the website that's updated on Thursdays. I'm assuming, Catherine, that you're in Maricopa County, and that's an assumption, so correct me in the comments if I'm wrong, but you can find that on the school's dashboard site, which is on maricopa.gov/schools dashboard. In fact, I can have producer Cortland add that to the bottom of the screen in just a minute. Let's see.
Every Thursday, except next week, it's going to be updating
Wednesday.
on Wednesday night.
Yeah.
And that number was 45. I'm sorry.
Okay.
That number's 45.
That's okay. I'm impressed.
So it went up.
I'm impressed at the math. Teresa writes, is AZ going to have a curfew? Teresa, we heard from the governor 2 days ago now, I think it was, and he did not give any sense that there would be a curfew implemented here in Arizona. There were a few things that were added, $25 million to our healthcare workers, some signs at the airport, testing at the airport to let our out-of-state visitors know about the rules here in Arizona, but we heard nothing of a curfew at this point, and Asraf's asking the same thing. Asraf said I pronounced his name correctly, so thank you for letting me know. Let's see. let me forward some of the, Ryan's saying, please answer, but I don't know what Ryan's question is. So Ryan, post it again if I missed it. Dawn's asking, what about club sports? Lots of conversation about this. We have lots of sporting events that are coming into Arizona to actually play here because the restrictions are so high in other places. So there's a lot of concern about that with all those people coming in from out of town, from California, from Utah, and from New Mexico. Yeah, Catherine's saying she is in Maricopa, and if we can post that website for her, we'll either have Cortland, our producer, post that in the comments right here for you, or post it on the bottom of the screen there. Garrett, the CLI comes out on Sunday. I do want to highlight this before we kind of wrap here today. The CLI stands for COVID-like illness. It's one of the numbers that they were tracking the school metrics on that board. I believe it's at about 5% right now. We can have a little hint of how that's going to look when it officially comes out on Sunday. Can you tell us what that looks like or how to find that?
Yeah, you can actually see where it might look like. The CDC actually has a COVID tracker for the CLI for emergency room CLI, not the inpatient, just emergency room. I have it shared up right now. It's at covid.cdc.gov, COVID data tracker, ED visits. And you can see right here is our COVID-like illness emergency room numbers. You can see it's at 5.6. It reached a high of 6.3 on about November 10th. And today, and this has, as you can see, about a 4-day lag, it's at 5.6. So it has been increasing, as you can see. Here it is back there at 1.9, and now it's at 5.6. So this basically tells you a good idea. And I do know that the inpatient CLI is a little higher than this one. And so when they look at them together, it's going to be in the 6-7% when it updates on Sunday.
Yeah, that'd be quite a jump if it went up to 7. That would be wild. And then that's updated in the morning, Garrett, or what time can folks look for that?
That is updated in the morning. I think it's updated on Eastern time at around 9 o'clock. So it would be updated before most people would check it here.
Yeah. Okay. Anything else that you're going to be watching closely?
I don't know if you saw this, but I did see that that Pfizer is filling for its EUA, and I guess it's moving really fast right now. So I just, because I know someone said something about who's standing in line for the vaccines, and my understanding is things are moving very fast with the Pfizer vaccine, and that the first people that are going to be given vaccines, of course, are going to be the healthcare workers. So that's what my understanding. I talked to a healthcare, someone who works in healthcare a lot, and that's what they've been telling me.
Yep, our frontline workers, absolutely, right away. Yeah, what a pivotal moment and really a landmark day in all this to have them submitting for emergency authorization. They said that the target date would be by Friday, and here we are. It's happening. So what happens after that? It's 2 to 4 weeks before this approval comes out. I would venture to guess they're going to try to get this thing moving pretty fast.
And then they're going to distribute it to frontline workers first.
And
perfect sense. So
and it's already in production. So just as soon as the yes is there, they're ready to go. Somebody was asking about the threshold. Kathy writes, what's the benchmark for CLI in schools? So Kathy, that benchmark has been moved up to 10% now. So we are getting closer to that. But if it was at 6 or 7, then there's still a little bit of time till that moves to 10.
Remember, before, just to remind Kathy, this benchmark is a guideline. As we've seen, a lot of school districts have already made the determination to go virtual without that guideline going to 10%. That Maricopa dashboard that we look at every single day, or not every day, but when we look at Thursdays, we see the districts that flip from yellow to red, and we've also seen school districts respond to that by going to virtual when it goes into the red.
Yeah. Okay. So that's going to have to sort of wrap things up where we are right now, and send you guys off on your weekend. Garrett, there was one thing before we leave on the Johns Hopkins site for folks who are interested in the updates. I know that you're going to have some of the Arizona updates on your Twitter page throughout the weekend. You can also find sort of a broad overview on the Johns Hopkins site. There's a really interesting map, a heat map, if you will. It sort of has hotspots across the country, so you can see how things look. It is a map in motion when you're watching that video on the site, and it is updated daily. So you can kind of get an overview of how the United States looks if you're interested in that when we're not here with you on the weekend.
Like when you actually play it. I'm not going to play it here because we're running out of time, but this is what it looks like. It gives you basically, it'll show you the movement of
Yeah.
what's going on in certain areas, and you can see, obviously the movement that's happening in Maricopa County and other places.
Yeah, you see why that's such a concern. And I just wanted to highlight that for folks because I know a lot of people are traveling to Chicago or traveling to California and across the country. So, all right, let's let everybody know where you can find us and catch up with us. Garrett will have an update still produced from his Twitter page tomorrow morning, I believe, right, Garrett? We can count on you on the weekend. At Garrett_Archer is the place to find him there. Kathy's asking, when is your next live update? We're going to be back here with you live on Monday. And then in the meantime, that was Garrett's Twitter account. You can find me on Twitter at Katie Rammel. And then some of you said to Facebook, what's the Facebook account? Facebook.com/news from Katie is my site. I try to keep you updated on there as best I can to some of the bigger breaking details that are coming out in all of this. And in the meantime, you can find all of our reporting on abc15.com. We've got newscasts coming up tonight for you at 4, 5, 6, 9, and 10 p.m. I want to make sure I caught them all. And our reporting can be found at abc15.com/coronavirus, the very latest info right there. In the meantime, have a very safe and healthy weekend. And we hope to see many of you back here on Monday afternoon, same time, same place.